Hello everyone. In this video, I'm going to tell you about hypokalemia. Mainly, this video focuses on treatment of hypokalemia. The normal potassium values are 3.5 to 5.5 milliequivalent per liter. Some books say 3.5 to 5.2, but hyperkalemia is more than 5.5. So, mild hypokalemia. When potassium levels are 3 to 3.5, it is mild. Moderate is when 2.5 to 3 milliequivalent per liter. Severe is less than 2.5 milliequivalent per liter. Now, in mild hypokalemia, the treatment is always oral via tablets or via syrup. Tablets, K-tab, slow K, these are the brand names they are given, or via syrup, which is pot chlor, it is given. Here you can see the names of the tablets, slow K, K-tab, and the syrup pot chlor. When patient can't tolerate these oral tablets, then syrup is given. This is the treatment of mild hypokalemia. In moderate hypokalemia, where 2.5 to 3 milliequivalent liter of potassium, if patient is able to tolerate orally, then oral is preferred. If patient can't tolerate orally or patient had arrhythmias, developed arrhythmias, or any ECG changes. In hypokalemia, the characteristic feature is U wave and flattening of T wave. If any ECG changes are seen or if patient had developed arrhythmias, and potassium usually causes muscle weakness. Decreased potassium usually causes muscle weakness. So, if there is any development of paralysis, then in this condition, IV is preferred. So patient if had any arrhythmias or developed any arrhythmias or any ECG changes, U waves or flattening of T wave or paralysis, then in these cases IV is preferred. IV via peripheral line. Maximum amount of KCL injection given as 10 milliequivalent per hour. Remember always KCL injection never given as IV push. The rapid IV push may cause arrhythmias, which is fatal. So, never give potassium injection rapidly. It is always given in the form of infusion. Here, if you see, this is the 1 ampule of potassium chloride injection. 1 ampule is 10 ml, and in 10 ml, there is 20 milliequivalent of KCl. The maximum you can give via peripheral line is 10 milliequivalent per hour. Now, we'll see about severe hypokalemia. Here, severe hypokalemia definitely you should prefer IV and it is via central line. The maximum dose you can give is 20 milliequivalent per hour. It is to be done with ECG monitoring. In severe hypokalemia, you can watch UCG changes, U waves, and flattening of T waves. It is always important to find the cause of hypokalemia. Just treating the hypokalemia with KCL injection or oral tablets will not treat the hypokalemia. The cause of hypokalemia is very important. Causes might be due to improper diet, like their diet doesn't contain potassium. Decreased intake of potassium might be the cause, or GI causes, or renal causes, or it might be due to some drugs which shift the potassium into cell, like insulin or beta agonists, like salbutamol, usually used in asthma. So first of all, finding the cause is very important. In treating hypokalemia, magnesium also plays a very important role. So always it is must to check the magnesium levels. In resistant hypokalemia, 1 gram MgSO4 in 100 ml NS is given over 45 minutes. In some hospitals, they give 2 gram MgSO4 in 100 ml NS over 60 minutes. In cases of hypokalemia where it is resistant to all the above treatments, you have to give 1 gram MgSO4. Before treating hypokalemia, it is always must to check the magnesium levels. KCl comes in this ampoule or ready-made bags like this. So if you need to prepare infusion, you can prepare infusion in NS or in this ready-made bag. It is already infused form. And KCl should not be given with dextrose or DNS because dextrose stimulates insulin. This stimulation of insulin shifts the potassium into cells which worsens hypokalemia. So KCl is always to be infused with the NS. This is about the treatment of hypokalemia. Thank you.